the American Medical Association, the American Pediatric Association, et cetera, still weigh that risk-benefit differently, and they would all suggest that the risk of disease is worse than the risk of vaccine, and they would all suggest that those vaccines still be provided to children. My name is Matt Ferrari. I'm a professor of biology here at Penn State University and the director of our Center for Infectious Disease Dynamics. The Department of Health and Human Services has changed the recommended schedule for childhood immunizations. And it has gone from what used to be 17 antigens or diseases protected against down to 11 as part of the regular schedule. And those that are no longer recommended as part of the routine schedule are still available and are recommended that families talk to their healthcare providers to discuss the safety and efficacy and protection afforded by those vaccines. Generally speaking, the change in recommendation for all vaccines, or the evaluation of all vaccines, is done as a risk-benefit calculation, right? Every time you provide a vaccine or any medical intervention or any medicine to a child, there are risks associated with it. And we weigh those against the risks associated with the disease that they might be exposed to, right? All of these, the current evaluation, according to HHS, is that the risks posed by these diseases in the United States right now are comparatively low, and therefore the decision to get these vaccines should be made on an individualized basis between parents and their medical providers. So all of these vaccines are still available. All of these vaccines are still covered by health insurance. They're recommended to be covered by health insurance. So from a family standpoint and from a family's interaction with their doctor, this actually doesn't really change that much. So if you would like to be vaccinated against any of these, you still have them available to them. And in fact, all of the major health organizations, physicians organizations, and scientific organizations still recommend all of these vaccines because there's been no change in the underlying evidence surrounding them, and there's been no change in our assessment of the risks posed by those pathogens or the safety and efficacy of the vaccines themselves. The risk to the general population of this policy change is twofold. One is that there's risks of these pathogens, these diseases, coming back in higher numbers. So not only will unvaccinated kids be more likely to have these diseases and suffer the medical consequences of them, right? But they'll also then have the potential to spread them to others. There's also health system consequences to this. One, it means that more kids are going to get sick with severe disease. Things like rotavirus, which are no longer recommended, right, can result in really serious diarrheal disease and hospitalization. And so now we'll have an additional burden on our health system, more kids going to hospital, requiring significant medical attention, and the costs associated with that are otherwise preventable by a fairly cheap and easy vaccine. There's another consequence that we need to worry about in terms of confidence and access to other vaccines, the ones that are still recommended, right? Because now what we're doing is we're sending mixed messages to families about the value of vaccines and where they should be getting their vaccine evidence and their vaccine information. Right? So before we had a consistent system where all of these 17 vaccines were recommended consistently by CDC and by HHS, and now we have sort of a mixed system. We're saying, well, some are recommended that everybody get them, and some are case by case, right? And by now giving that, having that variable set of recommendations just makes the whole decision-making process for families more complicated. Always the advice in this is to talk to your healthcare provider, both your family care provider or your pediatrician. I mean, they are the sources of the best information about this. They know you, they know your family, they know the risks associated to your child best. And the dominant opinion from all of the pediatric medical groups is that our understanding of these vaccines hasn't changed and that they are still recommended for all kids.